Imagine, if you will, the world back in late 2019. It feels like a different era now, doesn't it?
It really
I
does.
mean, the globe was just buzzing, interconnected. Cities full of life, airports packed, offices humming.
A constant state of motion, really.
S-
Effortless movement, instant communication. It seemed like the direction everything was heading.
Exactly. But then underneath all that, something else was starting,
Yeah.
quietly, almost invisibly, really,
Mm.
in Wuhan, China, December 2019. A few strange pneumonia cases, just little medical oddity, you might think.
Yeah, easily missed in a huge city like Wuhan.
But that little whisper, it was about to become, well, the biggest global health crisis in a century, something that would touch every single part of our lives.
Everything. Health, economy, how we connect. Everything.
So let's really unpack this huge shift. How did one, mysterious illness manage to sweep across the entire planet so fast?
And not just spread, but fundamentally change things. Our economies, our societies, how we even see ourselves.
Right. And what lessons, maybe tough lessons, did we actually learn from it all?
Yeah.
This thing really forced us to look at our weaknesses, didn't it?
It absolutely did, but maybe also our strengths. What's
Yeah.
really fascinating, I think, isn't just the virus itself, the biology of it.
Uh-huh.
It's the whole complex tangle of how humans reacted, how we adapted, the consequences, both short-term and long-term.
So it's the human story around the virus.
Exactly. This deep dive is really about how this tiny microscopic thing, SARS-CoV-2, managed to trigger such massive changes globally. It literally altered the path we were on.
Okay. Well, you shared your sources with us, and today we're diving deep into the story of the COVID-19 pandemic.
Yeah.
We want to get past the sort of daily noise, the headlines we were all glued to for so long.
Yeah, try to pull out the key insights.
Exactly. Understand what happened? Sure.
Yeah.
But more importantly, why it mattered so much and what it means for us now looking forward.
Right.
So we'll look at, the origins, how it spread, the different ways countries tried to handle it.
The huge impact on the economy, on healthcare, work, school, society itself.
And also the science, the incredible scientific response.
Definitely. The vaccines were remarkable.
And then crucially, what are the big takeaways? The lessons we need to hold on to.
Let's start right at the beginning then. Wuhan, those first few weeks.
Yeah, let's go back there. It feels like the first act, doesn't it? So quiet before the storm, but nobody really knew a storm was coming.
No idea of the scale. And understanding that beginning, I think, is absolutely key to grasping the sheer speed and, well, the enormity of what happened next.
How did it actually start? What were those first signals?
Well, back in December 2019, health officials there started noticing a pattern, an unusual number of pneumonia cases.
Okay.
And these weren't just random winter illnesses. People were showing up with very similar symptoms. Fever, a persistent cough, and crucially, trouble breathing.
But they didn't know what was causing it.
No, not right away. And that was the big problem. The cause was unknown. In a city as massive and connected as Wuhan, that unknown factor just created this cloud of uncertainty.
I can imagine. Doctors must have been scrambling.
Completely. They were seeing something new, something that didn't fit the usual patterns, trying to treat it, trying to figure out how to stop it from spreading. It was like they were working in the dark.
Flying blind, essentially.
Pretty much. Trying to piece together clues about a brand new pathogen with no instruction manual.
And that unknown element, that mystery,
Yeah.
that must have been terrifying.
Absolutely. But then science really kicked into gear incredibly fast, didn't it?
Yeah, the scientific community responded almost instantly, it felt like.
It was remarkable. By early January 2020, so just a few weeks later, Chinese scientists had figured it out. They identified the culprit, a novel coronavirus,
A new one.
totally new in humans. It eventually got the name SARS-CoV-2, and right away they started identifying its key features.
Like how contagious it was.
Exactly. Highly contagious. It spread mainly through respiratory droplets.
Yeah.
Coughing, sneezing, even just talking close to someone.
So everyday interactions became risky.
Very risky, especially in crowded places, cities, public transport. Perfect conditions for it to spread.
But there was something else too, wasn't there?
Yeah.
Something that made it even harder to track.
Yes, and this was absolutely crucial, a game changer, really. The fact that some people could spread the virus without showing any symptoms at all,
A symptomatic spread.
or pre-symptomatic spreading it before they felt sick, it meant people could be walking around feeling fine, going about their lives, but infecting others.
Wow. So you couldn't just isolate the people who were obviously sick.
Exactly. Your standard public health playbook, find the sick people, isolate them, just wasn't enough. It was like trying to catch smoke. This invisible spread made containment incredibly, incredibly difficult right from the start.
That really does change everything. An invisible enemy moving through the population, and it definitely didn't stay put in Wuhan.
No, not at all. The speed it broke out of China was, well, frightening.
When did the first cases pop up elsewhere?
The first confirmed cases outside mainland China were reported in January 2020, just weeks after it was identified.
That fast.
That fast. And from there, it just exploded globally. Every day, it seemed, another country was reporting its first case. It just marched across continents.
So a virus found in one city in December.
Was basically everywhere by January, February. Our interconnected world, all that global travel, unfortunately, became the perfect highway for it.
And then came the big declaration.
Right. In March 2020, the World Health Organization officially declared COVID-19 a global pandemic.
What did that mean, practically?
It wasn't just a label. It was a formal acknowledgement that this wasn't contained anymore. It was spreading sustainably within communities across multiple countries worldwide.
The point of no return, in a way.
In many ways, yes.
Right.
And that triggered this massive global scramble. Countries started slamming borders shut, restricting travel, launching public health campaigns, bringing in the first lockdowns.
Desperate measures.
Trying desperately to slow down something that already seemed to be everywhere. The world was suddenly facing the same enemy, but how we faced it, that was very different.
Yeah, so with the virus now officially global, how did countries react? Because it definitely wasn't a unified response, was it? We
Yeah.
saw wildly different approaches almost immediately.
Not at all uniform. And that really raises a key question. Why such dramatic differences? And maybe more importantly, what can we actually learn from comparing those initial responses?
Right, what worked, what didn't, and why?
Exactly. Every government was under immense pressure, facing this novel threat, making huge decisions with incomplete information. Their own politics, their economies, their culture, even past experiences with epidemics, it all fed into how they reacted.
There was no playbook for this.
None whatsoever. They were making it up as they went along, really.
So what were the main strategies we saw?
Well, you saw some countries go for really strict, aggressive measures right away. Think of China, with those incredibly severe lockdowns, literally sealing off cities like Wuhan.
Yeah, that was drastic.
Or South Korea. They learned from the MERS outbreak and went hard on testing, mass testing, plus really intensive digital contact tracing and quick isolation.
Trying to stamp it out quickly.
That was the idea. Identify, isolate, track contacts, break the chains of transmission fast. And in terms of controlling the virus early on, those methods were often quite effective. Case numbers stayed lower initially.
But they came at a cost, right?
Oh, absolutely. Huge costs. Major restrictions on personal freedom, massive economic disruption, things that many democratic societies found harder to implement or were more hesitant about. The effectiveness in suppressing the virus was clear, but the long-term societal impacts are still being debated.
Okay, so that's one end of the spectrum. What about other countries, particularly in the West?
Well, in contrast, many Western nations, the U.S., a lot of European countries, their initial response was often slower, more hesitant, maybe more decentralized.
Why the delay, do you think?
It's complex. There was public debate about how severe the threat really was, huge concerns about the economic damage of lockdowns, and this fundamental tension between individual liberty and collective public health mandates.
So less about eliminating it, more about managing it.
Initially, yes. The focus was often on flattening the curve, slowing the spread to stop hospitals being overwhelmed rather than total suppression. But this slower start often faced criticism.
Because cases surged anyway.
Exactly. Delays in widespread testing and setting up effective contact tracing and consistent messaging about masks or distancing. Many argue those delays allowed the virus to get deeply embedded, leading to much worse outcomes later.
So the trade-off was maybe less immediate economic pain, but potentially a bigger health crisis and longer shutdowns down the line.
That seemed to be the pattern in many places. Why the hesitation? Was it an intelligence failure, political calculation, cultural resistance? Probably a mix of all three. But those early choices had really profound consequences.
But regardless of the strategy, aggressive lockdown, or slower mitigation, the economic hit was just massive, wasn't it? Globally.
Well, immense. Unprecedented in modern times, really. People compare it to the Great Depression. It wasn't just a downturn. It was like the world economy hit a brick wall.
A sudden stop.
That's the term economists used.
Yeah.
Lockdowns, stay-at-home orders, they just instantly vaporized millions of jobs. People were furloughed, laid off, just like
Businesses too.
everywhere. Big corporations, small local shops. So many had to close, some for good. Think about high streets, city centers. Ghost towns almost overnight.
It hit every sector.
Pretty much.
Yeah.
Manufacturing choked because factories closed, supply chains just buckled, remember the shortages? Toilet paper, microchips, everything.
Travel, hospitality,
Decimated.
ground to a halt. Airlines, hotels, restaurants, entertainment, arts, anything involving people gathering face an existential crisis.
Yeah.
It was unique because it was so sudden, so widespread, and truly global all at once.
Unlike past recessions that might start in one region or sector. Right. And it forced governments everywhere into massive spending stimulus packages, support schemes, just trying to keep things afloat, which of course has its own long-term consequences for debt and inflation.
And while the economy was reeling, the healthcare systems themselves were just under siege.
Absolutely buckling under the pressure. The sheer number of patients needing intensive care, it overwhelmed hospitals in so many places, it went way beyond their capacity.
What were the biggest weaknesses it exposed?
Well, firstly, critical shortages. Ventilators, PPE masks, gowns, gloves, the basics. Supply chains just weren't built for that kind of surge. Countries ended up competing, bidding against each other for vital equipment.
A desperate situation.
And the human cost for healthcare workers, unimaginable. Doctors, nurses, cleaners, paramedics working insane hours, facing constant risk, making impossible decisions about who gets care when resources ran out. The burnout, the trauma, it was immense.
Moral injury, they call it.
Exactly. And it showed how, in many places, public health infrastructure, the behind-the-scenes stuff like disease surveillance, testing labs, contact tracing teams, emergency planning had been underfunded or neglected for years.
It wasn't just about hospital beds.
No, it was about the whole system's readiness. It hammered home the need to invest in public health, not just as a response to illness, but as a core part of national security, being prepared.
Okay, so beyond health and the economy, which were obviously huge, the pandemic just seeped into everyday life, didn't it? Changed how we worked, learned, socialized, everything.
It really did. And what's interesting is how it took existing trends, things that were already slowly happening, and just put them on hyperdrive.
Like remote work.
Exactly. Remote work was, gradually increasing, but still a bit niche in many fields. Then suddenly, boom, millions were working from home overnight. Kitchen tables became desks.
Same with schools, universities.
Mass migration to online learning. Often with very little warning or preparation, living rooms became classrooms.
And the tech had to keep up.
Well, it accelerated the adoption of tech massively. Video conferencing, Zoom became a verb, cloud collaboration tools, project management software, they became essential lifelines.
And surprisingly, it worked to some extent.
For many, yes. Companies found productivity didn't necessarily nosedive. Some people thrived working from home. It really challenged old ideas about needing to be physically present in an office.
It makes you wonder, what if the tech hadn't been ready?
It would have been vastly different, maybe impossible on that scale. This huge forced experiment has basically reshaped the future of work. We're still figuring out the hybrid model, the impact on cities, corporate culture.
And our social lives just got turned upside down too. Basic human interaction suddenly felt risky.
Absolutely. Social distancing, lockdowns, necessary for health, but they led to so much isolation, so much loneliness across all ages.
For social animals, right. That sudden lack of connection must have hit hard.
Profoundly. We had to adapt. Video calls replaced meeting up. Virtual quizzes replaced pub nights. Technology helped bridge the gap, definitely.
But it's not the same, is it?
No, it couldn't fully replace face-to-face connection. And that took a huge toll on mental health, anxiety, depression, grief. It soared. We had to find new ways to connect and maybe appreciate the value of physical presence more.
And then, on the bigger stage, politically, this was a massive test for governments everywhere.
A brutal stress test. It really showed which governments could respond effectively in a crisis and which couldn't.
What kind of weaknesses did it expose?
Things like bureaucratic sluggishness, fragmented decision-making, poor communication, lack of preparedness, problems that maybe existed before but were suddenly thrown into sharp relief.
And seemed to deepen divisions in many places.
Definitely. The pandemic response itself, masks, lockdowns, vaccines, became incredibly politicized. It fed into existing polarization, eroded trust between people and leaders in some countries.
Leaders were judged harshly.
Absolutely. Some were praised for decisive action, others condemned for inaction or mixed messages. It really put governance under the microscope, forcing questions about the balance between individual rights and collective safety in a crisis.
Okay, let's shift to something more positive, though still complex. The vaccine development, that was, well, astonishingly fast.
It really was. Here's where it gets really interesting, I think. A truly remarkable achievement. Many experts thought it would take years, maybe 5, 10 years.
But it was less than 1 year.
Less than a year from identifying the virus to having the first vaccines approved for emergency use in December 2020. That's just unprecedented.
So how was that possible? Was it just luck or throwing money at it?
Not just luck, no. If we connect this to the bigger picture, it was built on decades of groundwork, foundational research, plus an absolutely extraordinary level of global collaboration.
What kind of foundational research?
Specifically, years of work on new vaccine technologies, especially mRNA.
Right, the mRNA vaccines were key.
They were, and that technology wasn't invented overnight for COVID. Scientists had been working on mRNA for other things, like cancer therapies, for a long time.
So the platform was kind of ready to go.
Essentially, yes. They understood how to use messenger RNA to basically give our cells instructions to build a harmless piece of the virus, the spike protein. Our immune system then learns to recognize and fight it.
So it doesn't use the actual virus.
No live or inactivated virus. It's more like giving the body a blueprint. And the beauty of mRNA is its speed and flexibility. Once scientists had the genetic code of SARS-CoV-2, they could design the vaccine sequence very quickly.
Like programming software.
Kind of, yeah. It's slashed development time compared to older methods. But it wasn't just the tech. The global cooperation was also key.
How so?
Governments, drug companies, researchers, nonprofits, they shared data, shared findings, worked together in ways that just don't normally happen because of competition. Plus, massive investment, public and private, allowed them to run research, trials, and regulatory steps in parallel, not one after the other.
An unprecedented team effort.
Truly, it redefined what's possible in responding to a health crisis.
But making the vaccines was only half the battle, right? Getting them out to billions of people. That was another huge challenge.
A monumental logistical challenge. Probably the biggest vaccination campaign in human history.
What did it involve?
Everything. Setting up distribution systems, managing the cold chain, especially for the mRNA vaccines needing ultra-cold storage, establishing mass vaccination centers in stadiums, community halls, training millions of staff.
And just keeping track of it all.
Huge data management systems for appointments, doses, tracking. The scale was just mind-boggling.
And it wasn't smooth sailing. There were complications.
Major complications.
Yeah.
One of the biggest was vaccine hesitancy.
Doubts about safety or effectiveness.
Yes, fueled by a torrent of misinformation and disinformation, especially online. False stories spread like wildfire, creating fear and skepticism.
So it wasn't just about supply. It was about demand, too. Convincing people.
Exactly. Public health officials were battling not just the virus, but an infodemic of bad information, trying to build trust, explain the science clearly in a very polarized environment. It was incredibly tough.
And then there was the issue of getting vaccines everywhere, globally.
Yes, global equity was a massive problem. Wealthier nations secured the bulk of the early supplies, leaving many lower-income countries waiting months, even years, for adequate access. That inequality undoubtedly prolonged the pandemic.
So looking back at this whole immense experience, what are the big lessons as we sort of move forward? What do we need to remember?
That's the crucial question, isn't it? How do these lessons stick? Because this wasn't just an event we lived through. It was something that fundamentally reshaped our thinking in so many areas.
Like public health preparedness.
Absolutely, number one. The pandemic brutally exposed weaknesses in public health infrastructure. It wasn't just about hospitals. It was about surveillance, testing, tracing, communication. There's now a much stronger understanding, or there should be, that we need to invest consistently in these systems.
And international cooperation.
Essential. Viruses don't care about borders. A threat anywhere is a threat everywhere. We saw failures in cooperation, but also successes. The lesson is we need more robust global mechanisms for sharing information, resources, and coordinating responses. There's a shift towards thinking about global readiness, pandemic treaties.
But will the political remain?
That's the million-dollar question. Sustaining that focus and investment when the immediate crisis fades is always the challenge.
And work. You mentioned the shift there. Is the office dead?
Not dead, maybe, but transformed. The pandemic proved remote work is viable for many roles. It accelerated that digital transformation by years, maybe decades.
So more flexibility.
Likely, yes.
Nor you.
But it creates new challenges, too. Managing hybrid teams, maintaining company culture, ensuring equity between remote and in-office staff. It's also changing cities, real estate, transport. The ripple effects are huge and still unfolding.
What about education? The online shift highlighted big gaps, didn't it?
Huge gaps. The digital divide became impossible to ignore. Access to devices or reliable internet, It's fundamental for equitable education now. That has to be a priority.
And are we seeing lasting changes in teaching itself?
I think so. More blended learning, more use of digital tools, but also maybe a renewed appreciation for the value of in-person interaction for students and teachers. Again, it's an evolution.
And globalization.
Right.
Travel shut down, supply chains broke. Did it make us rethink being so interconnected?
It's certainly forced to rethink. The restrictions on travel were shocking, reminded us how much we took free movement for granted. And the supply chain chaos?
Yeah, the empty shelf.
It showed the fragility of those hyper-efficient, just-in-time global systems. So now there's much more focus on resilience, diversification, maybe bringing some critical manufacturing closer to home. Not deglobalization, perhaps, but a recalibration of risk.
Okay, and something maybe less visible, but deeply felt: mental health.
Hugely important, and a legacy we'll be dealing with for a long time. The isolation, the fear, the grief, the economic stress. It pushed mental health issues to the forefront.
Increased anxiety, depression.
Across the board. It really highlighted how crucial mental health care is and how under-resourced it often is. There's a growing push now, thankfully, to destigmatize mental health, integrate it better with physical health, improve access to support. That's a vital lesson.
The pandemic also put science front and center, but in a complicated way.
Very complicated. On one hand, it underscored how vital scientific research is. The vaccines are the prime example. People became much more interested in epidemiology, virology.
But it also became a battleground for misinformation.
Exactly. It showed how difficult it is to communicate complex, evolving science clearly, especially when dealing with uncertainty, and how easily misinformation can spread and undermine trust in experts and institutions. That's a huge challenge for the future.
Did we see any environmental impact? Lockdowns meant less pollution for a bit.
There were those temporary drops in emissions, cleaner air in some cities, which was interesting. But counteracting that, there was a massive surge in single-use plastics, PPE, packaging, so a mixed bag environmentally. And arguably, the immediate crisis diverted some focus from longer-term climate action.
And finally, maybe one of the starkest lessons: inequality. The pandemic didn't affect everyone equally, did it?
Not even close. It hit vulnerable populations hardest: the elderly, people with pre-existing conditions, marginalized communities, essential workers in low-wage jobs.
Higher infection rates, worse outcomes.
Consistently, it's shown a harsh light on those pre-existing disparities in health access, housing, job security, all those things that make certain groups more vulnerable in a crisis. It showed how public health and social justice are deeply intertwined.
It really held up a mirror to society's fault line.
Precisely, and underscored the urgent need to address those systemic inequalities, not just for fairness, but because they impact everyone's health and resilience in a pandemic.
So, when you wrap it all up, the story of COVID-19, it's just profoundly human, isn't it? So much loss, so much challenge, but also incredible resilience.
Absolutely. It showed our fragility. Yes, the consequences were devastating. But almost in the same breath, it highlighted our capacity to innovate, to adapt, to act collectively when we really need to.
What are the absolute core takeaways for you?
I'd say 3 things stand out. 1, global cooperation is not optional for global problems. We sink or swim together. 2, science and evidence have to lead the way, not politics, not ideology. 3, never underestimate human resilience, adaptability, and creativity. We found ways through it.
It's not really over, is it? The effects linger. The world is different now.
It continues to shape things. Norms have shifted. Economies are adjusting. We're hopefully more prepared. These lessons, if we actually heed them, will influence how we face whatever comes next.
Which brings us to a final thought for you, the listener. As you reflect on all this, maybe consider, how might this shared experience, this forced understanding of just how connected we all are, how vulnerable we all are, how might that change our ability to tackle other huge global challenges, things like climate change, future health crises? Can that sense of shared fate help us find common ground?